with, we have to cover one of the foot so that all the energy, heat that coming from this end goes all the way to the top and is being stored on the other foot. So it's very important that you put a towel around your feet and just cover it up properly. So that means this means the heat is being saved before it goes to someone else. The second step before we do this one, we always take the prayers first. Prayers is important because you're giving the Lord strength and help the patient and yourself as well. The next one is the warm up. So you put your two hands like this on the feet on this end, on the end here, and then rub it. And the third step is take the oil, which we prefer to use a castor oil. This is the best oil for the massage because the oil has a lot of values on that one. So you take your hands and you do this on the side. This rub it. This one here, and then take the two thumbs and go over these feet on the foot. So what we are doing it now here, warming up, stimulating it here. Anytime, Doc, anytime I press the point and you feel a little tender spot or hurt you, you will tell me about it. So they will tell me exactly what your ailments are. So here we're doing this one here. That's one step. There are 39 steps of the strategies of this therapy here. So the number 2 is after that is this one, the hands. All the way up from the top, all the way to the bottom. This one you do it about 10 times. The next one is on the other side. This is where your teeth, your jaws, teeth are being stimulated. The next one is take your, what I call a MRI stick. Take a stick, and then this is the thigh therapy that we are doing on the thumb, on the thumb, all the way to the toe, from the toe rather, all the way to the bottom. The same thing about 10 times. That means all the organs on the side are being stimulated. Then the next one is go over the head. This is your brain. This is the sinuses. And this is what we're doing, all the sinuses. If there was any nods or any noise coming out, I'll know that there's an issue on the sinus. And I asked the patient, do you have an issue about the sinus? She said, A or nay? She said, yes, I had the sinus. In fact, I'm surprised that she didn't have this right now. She was coughing, and she should have that one here somehow. Maybe the second foot will tell me. Go around on the seat, both the sides. And then on the other side. Same way, 10 feet. You feeling better?
A little pain, right?
Pain here. Where does it pain now? Here?
And on down closer to the ear.
Here, right, okay.
Right.
Okay. Now, for that, you refer to the chart which I have here. So it will tell you exactly where the pain is. When you say the pain was on this side here, so when you look at the pain number is 31, is on the shoulder, or maybe a little lower, maybe the thighs as well. So that's exactly what it tells you.
Mm-hmm. I'll tell you right there.
Maybe your knees. There's
Yes.
one also the knees also.
Mm-hmm.
That's where the knees are.
Yeah, exactly, because that's what I've been having problems with.
Right.
The
The knees on this one here. So she will tell you exactly what the knee. So what you do is just put a massage on this one. We have to find the the remedy for that one, what is to be done on that one. So we'll talk on that one. Once we have finished this one, we'll tell her what to do for the knees. Okay. Go over there. This is again from the toe all the way to the head and to the knees. All the way on the second one, this one here, and then when you go, this is the neck, these are the teeth, jaws, if she has any issue of the jaws or TMJ, that's what we'll tell you. This one, when you go down this one here, this is the thyroids, so working on the thyroids. This one here, you're working on the lungs. If there's any issue on that one, we'll know about it. Then you go all the way up from the top to the bottom here. You are stimulating, you are circulating the blood, you are awakening all the organs in one form or the other by doing that. This Thai therapy is very effective and it helps. Now we go all the way. Did you find anything here?
No.
No. Okay. So that's one is that. And the next one is going with the thumb. Number 3 stage. So go over there and then bend it and just use your thumbs, knuckles, all the way up here. This one. All the strategies are to be 10 times. Every one of them. This one here. Ovaries, anytime there's ovaries, testicles with the men, and then this on the back side is the sciatica. The same way, you do 10 times on the other side, where your back, your neck, back, your knees, everything is on this side here. Same way here, every one of them. Then when this is done, you are working on this one, there's a lymphatic glands. So all the toxins that are there, you're taking the toxins, the dirt or the toxins that come out of your system have to be done this way here. And to go all over the place, all over the feet. This one here, bending it down here. Then you work on this one like with the knuckle. Just every finger, this one, that's where the teeth and the jaws are connected here. Then we take the MRI stick, and this is where you poke on every part of it. Like if I'm doing it here, this is the brain. Okay, so that's the sinus and the brain.
Ouch.
Ouch. Now this is pituitary gland. Pituitary gland is stress, anxiety, fear, all those kind of things that are. The pituitary gland is the most important gland in the body. So that's what it is. Most of the time we'll have that issue on that one too. Like this one here, the neck. This one, again, the sinus. So that's the beauty about this reflexology. We tell you exactly what your issues are with just this little stick in here. Go all the points are marked on that one, and when we show you, we'll be told about it. It's all in the chart. What everyone tells you. These are eyes. These are ears. This is the solar plexus. This is the adrenal. This goes down. Every one of them. This is your heart. Spleen. Goes down. Every one of them. So that tells you exactly what the issues are. Then you ask the patient to turn the knee and you work on the knees. Again, take the oil and smear it on the knees here.
What kind of oil is that?
Huh?
What kind of
It's
oil?
a castor oil. It's a castor oil which is supposed to be the best oil. People use all kind of oils, but I strongly believe the castor oil is the best. So this one here, and then go all the way. Now this one here, all the calves. Now many times there will be a pain on that one because all the weight of the 2/3 weight of your body is being
Right there.
taken by that one here. Now,
Right there.
there we go. See, it was hurting there. She didn't know until I pressed it. The hurt was always there. But now when I do this one, that's what it does. So we have to massage it and make sure that this pain is gone completely. Same way we do it on the other side. 10 times. Go all the way. And then the thumb going up and down, up and down. Now, most of the time the pain is here on the knees, here, right here. For that, we always apply the Mona balm. That's the balm that is more effective. Apply this one here, smear it, massage it. Now this Mona balm has to get inside the muscle. So you have to do it 3 times a day, every time. After you have done this one, put a warm pack or a cold pack, whatever the hurt is, what is being done. So that's what is to be done on that one. So then you press it, move it, do it here, and the same way, that's the end of it. So then that's the end of it. So this is one foot, and the same way will be done on the other foot, but one foot is right now the perfect for to show exactly what it is. Okay. Okay, after having finished the one leg, now you change the towel because all the heat that was converted from this feet left, now it's going into the right foot. So this one here again, cover the foot with the towel. This one here, all the heat that was be transferred from that one will be saved on this foot here. Okay, now the same procedure, start at the very beginning. The first start is warming up. Put your 2 hands on the knuckles. On this one here is on the side. This is the warm up. And then apply the castor oil again. Castor oil. Take a little bit of it. Put it on the hand, smear it on the side and on the back. And then the next step is taking 2 thumbs on the feet, on the foot. Go 10 times, up and down, up and down. And then with the knuckle, ten times. Then the same way with the knuckles on the toes, the bottom of the toes, where there's the teeth or the Then, of course, take the stick, what I call the MRI stick. This is the thigh therapy, by the way. So you go on that one all the way. You you're stimulating, you're circulating the blood, and if anything that's there, because all our organs are not being stimulated, they are not being touched by one form or the other. On the teeth, on the foot, all the meridians are connected to your organs right there. In other words, the meridians are like a cable or a wire. So anything that goes in, if there's anything that tells you, so it gives you an indication that there's something is wrong there. Something is toxin, or something is wrong, or blockage. So when it does that one, it tell you exactly the blockages. That blockage is disturbing the system. So that's what's happening. Here we go again with the thyroids. The thyroids. Now, if there's any pain on that one, we'll tell you the thyroids. Thyroids have the meaning behind which we have told you about what are the thyroids. They could be anxiety, weight loss, weight gain, all that are connected on the function of the thyroids. We have told you about it, and you've read about it in your book. We go all the way up from the top to the bottom 10 times. On the side, ten times. On the other side, 10 times. This way. All the organs are connected to this chart here.
Okay. Okay, all of it. Okay.
Okay. So this chart will be with you all the time. On the left foot, on this side of the left foot is heart. The only difference between the left and the right foot is the heart and the liver. Liver is on the right foot, heart is on the left foot. That's all it is. Rest of all the parts, gallbladder, stomach, pancreas, duodenum, small intestine, appendix, everything is the same on that one too. Then we just stimulate again with the thumb. This one here. This one will all be shown in the chart. When we give you the chart, the chart will show you exactly what are the strategies. We call the strategies of this one. There are 39 steps that you have to do on that one. Like this one here is the sciatica. If there's anything wrong here, and if there's any nodes that you find, they will tell you that something is not right. Like if I'm pressing it here, it also shows you. Now this is where the adrenal glands are. Adrenal glands are the one that sends out all the hormones to the different organs. In other words, when you percuss it or massage it here to anybody for about 5 or 7 minutes, you feel like sending out the extra hormones to the organs. It's just like taking a liquor or a scotch or a whiskey, so that it makes you feel much better that way. So when you do this one for about 5 minutes, the person will feel so intoxicated, feels lazy and feels like sleepy, because you are giving him an extra boost of the hormones. So this is where it's most important. Anytime your patient or your family members or husband or wife, when she's stressed out or tired, have her sit down and just percuss it on this one for 5 minutes and 7 minutes, and you will see the difference right there. And again, the same thing with the toxin, the lymphatic glands, the neck here. Now, the points that we work on this poking is the one that tells you exactly now. So the top part is the brain here. This again, the pituitary gland here.
Could you stop for a second?
Okay, this is like when I'm doing it here, this number 5 according to the chart, which is the frontal sinuses. in the sinus here. And then all the number 5s on top here. Every one of them, just poke it. And then number 15. Number 15 is the, no, wait a minute, hold on. Number 6. Oh, sorry. Number 6 is the pituitary gland, which I told you about. Everyone, the pituitary gland is the one is connected to the stress. This pituitary gland is right behind in the back of the brain, which is a very important gland on that one. Then it goes on the bottom here, and then you go on the side. Okay, this is the neck part of it. You see, so that's what it is. Number 9 is the nose on the left side, and the number 8 is the temporal area left here. Okay, so goes up all the way. Here, this is your eyes. This is your ears. Now, many times when you press it, the eyes will probably tell you exactly what the eyes are, what was the problem or the issue. We never use the problem, we use the challenges or issues. Because if I say a problem, they say that's not a problem, it's a challenge. So when I press it here on that the eyes, and it says, oh, it's hurting me, that means either the dry eyes or strained eyes or wet eyes, that will be telling you. And here is the ears. So when you press this one here, there's a ringing ear, titanous ears or something goes on that one. And then here we go with the solar plexus, right in the middle. Right here in the adrenal. Right in the bottom here, the sciatica. Now this one here, again, is number 13, is the thyroids. So again the thyroids comes in here. Number 20 here, we always ask them when it says stomach, you ask them about your bowel movements. How are the bowel movements? If she says regular, constipated, irregular, then we know what is the answer, what's the remedy for that one. And then goes down here again, number 16, and here number 20 is the intestines. Every part of it, all the ones here. This is liver. Number 1, number 3. Go according to the chart. The number 24 is the appendix here. Okay. Number 28 is the solar plexus. Number 30 is the elbow here, or pain here on the shoulders. So that concludes that one, and then again put the feet on the knee. This is the knee that's hurting you. That's more of that one. Now, when one knee is hurting you, that means tells you that you are pressing more pressure point on it. We do not walk this way. We walk fast this way and that way. So on the right foot, you are putting more stress pressure on that one too. Many times when you are carrying the bag or something is on that side, it all takes the toll on your knees as well. We're forgetting about it, why the knees are hurting. It doesn't hurt. And do not do the running for the exercise. Always walk. Running will mess it up now. This one I'm doing it again on the knee here for Dr. Davis here. And see this one here again. She's all tender here. Tender. So again, apply the balm. This has got the natural healing power on that one too. This one, in 10 minutes, the pain will be gone, but that's not the answer. This has to be applied about 3 times a day and put a warm pack on that one, so that makes it much better. It's more effective that way. Once this is done, then you go on the side of the calves with the same thing. And when you find that the muscle is tight, you'll know that means there's a pain in there. This one will go on this one here 10 times. Same way. The calves, the foot takes the 2/3 of our weight is being pounded on the feet, so that's where it hurts. Then you press it hard, push it. One more time, when you start it the same way, this way. Release the heat, that one here, and then just, that's it.
Okay.
Alright? And then of course you wipe it off and everything. How do you feel now?
Feel good.
Feel good, right?
Yes.
It's all relaxed now. What we did it here was the circulation of the blood, of your circulation of the entire organs was being circulated. You feel much better that way too.
Closing remarks.
Well, you ask the patient, this is how do you feel, and is there any pain, or give them the regimens, whatever the pains were, what are the regimens, what we call it a homework. When you go home, you will do such and such things, whatever your issues are, and we tell them. That's the whole idea behind it. It's called the reflexology or Ayurvedic. Ayurveda is the science of life, which is a 4,000-year-old Indian holistic way of treating the patients. I'm Jay Khatau, the practitioner for Ayurvedic practitioner and reflexology therapist.